Good afternoon, everybody. Hello, hello. We're up. All right, good afternoon. Welcome. Happy Friday. Happy December. Hello. Hi. All right, good afternoon. Thanks everybody for joining us today at our Colloquium series. We're really privileged today to have two experts joining us from the CDC's National Institute for Occupational Safety and Health, the Office of Total Worker Health. As you all know,
There we go.
where would I be without you? Thank you. As you all know, public health is focused on promoting and protecting the health of people and the communities where they live, work, play, and learn. Today, we're going to focus on work, where most of us spend at least half of our time while we're awake. As you also know, we consider this a real priority for our School of Public Health. Given the disproportionately high rates of occupationally related illness and injury that are seen in Appalachia and West Virginia and in other rural communities throughout the nation. We've prioritized this topic not only through our ongoing collaborations with our colleagues at NIOSH here in Morgantown, some of whom are here today, but also through our occupational medicine physician training program, through our Department of Occupational and Environmental Health Sciences, and through our growing industrial hygiene program. So some of you may recall, if you were here at the time back in 2018, that one of our first speakers for Dean's Colloquium series was the director of NIOSH, Dr. John Howard. And Dr. Howard came and spoke with us at that time primarily on the topic of the nation's opioid epidemic and its impact on workers throughout the nation. But he also mentioned the concept of total worker health back in 2018. So after a bit of a brief forced hiatus, we're now able to get back to that topic, and I'm really excited about getting back to it today with our two speakers. Our speakers today are Dr. Chosewood and Ms. Chia-Chia Chang, who are leaders in the advancement of worker safety, health, and well-being. And today they'll be presenting on total worker health strategies for the future of work. Dr. Chosewood serves as Director of the Office of Total Worker Health and Associate Director for Strategic Initiatives at NIOSH, promoting the protection and improvement of the overall health and well-being of workers through research, intervention, development, and partnerships. He also co-leads the NIOSH cross-sector dedicated to healthy work design and well-being. Additionally, since 2018, Dr. Chosewood has coordinated efforts to address the nation's drug overdose problem and its broader mental health crises affecting workers in the workplace. Ms. Chang is the coordinator of the NIOSH Office of Total Worker Health and Healthy Work Design and the Healthy Work Design and Wellbeing cross-sector. In this capacity, she leads collaborations to share research and identify promising practices for advancing worker safety, health, and well-being. Ms. Chang also guided the development of a worker well-being framework and the NIOSH Worker Wellbeing Questionnaire, known as the Wellbeing Key. It's an honor to have Dr. Chosewood and Ms. Chang with us today. So please join me in welcoming them both for today's colloquium.
Hi, folks. It is our pleasure to be here with you today. Thanks very much for the kind introduction and for coming out on a chilly Friday. We know some of you are headed to final, so good luck with that. We both shared sort of a little panic attack, putting ourselves back in the shoes of our students here today. So good luck with your finals. Just a quick hello from Dr. John Howard. He sends his regards. He's quite interested in the success of the Total Worker Health Program because he actually coined the phrase total worker health. So we are happy to continue to move that program forward in his sort of as his legacy program here at NIOSH. He also was instrumental in our trademarking, one of the few federal trademarks, which includes total worker health. So we're pleased about that. A quick update from CDC. We are part of the Centers for Disease Control and Prevention. Chia-Chia is based in our NIOSH headquarters, which are in Washington, D.C. I'm based in Atlanta. We have a NIOSH presence in Atlanta to keep us connected to the mothership of CDC. And the first half of my career in public health was at CDC. I've been at NIOSH now for about 10 years or so, and continually work to keep us connected to the broader public health infrastructure. Oftentimes, occupational medicine and occupational safety and health are sometimes thought of separately from public health, but it is essential, I think, for us to continue to draw the connection between those two together and to build the relationship between the broader public health community and our own interest in workplace safety, health, and well-being. CDC has roughly about 40 to 50 people deployed around the world currently, and then another several hundred deployed to our Emergency Operations Center in Atlanta. Current outbreaks, obviously COVID-19 is still a declared public health emergency. I think yesterday in the world there are about 520 or so deaths from COVID. So it's still a deadly virus, still causing significant public health distress and morbidity and mortality. COVID, now co-mixed with other epidemics in the nation, including flu and respiratory syncytial virus in children, has elevated the risk for hospital stay quite dramatically. Many hospitals in the country are reporting more than 90% capacity. Many pediatric hospitals are nearer to 100% capacity. So to say that we're behind or past the epidemic would be untrue. The good news is it's taken on a safer character, if you will. Most of the deaths now are limited to people over age 65. The vast majority in people over age 55. Likely risks include some underlying chronic condition. The other change in the character is that vaccines are making a difference in deaths and hospitalizations. So for those who would say vaccines are not making a difference, we've seen a dramatic difference in the death rates and in hospital stays related to the post-vaccine era. There is a new vaccine you're probably aware of. We're encouraging everybody to get the Omicron-specific vaccine, which is now available. And there continues to be evolution of the virus. Chia-Chia was just telling me that we continue to be watching some substrains of Omicron variants that are struggling to be matched with the efficiency of the vaccine. So that is a likely continuing to change environment where changes to the vaccine are likely to continue as the years move ahead. But increasingly, this is a survivable condition, and even more so when people remain fully vaccinated and up to date with the latest vaccine. Other vaccine related issues that CDC is involved in, clearly pushing more RSV vaccination where appropriate. That's going to be important in this current outbreak. What we saw really were children sort of protected from community exposure for a couple of years because of COVID. So now we have all the newborns at risk for RSV, as well as 2-year-olds, 1-year-olds, 2-year-olds, 3-year-olds who may have been protected from natural exposure during the pandemic. So that's super concentrating RSV outcomes. Mpox. Anybody heard of Mpox? Just the WHO renamed monkeypox to Mpox this past week, I believe. CDC is actively involved in the Mpox response, which now I believe is in 80 countries. There are more than 80,000 worldwide cases, roughly 50 or so deaths, I think, around the world. I think for me, the takeaway is that our vaccination strategies targeted to high-risk populations was a dramatic success. And the falling rates of monkeypox in the US continue. Really pleased with how the communities at risk have stepped up and are doing quite well. So we do not expect significant monkeypox spread. We still worry about its presence in schools, daycares, congregate settings, but largely that's not been seen today. There are also cholera outbreaks in about 6 countries around the world. CDC has folks deployed in about 5 of those 6 countries. That obviously is a quite deadly condition. Those are more, I would say, the routine deployments that CDC is regularly. NIOSH has a role in all of these deployments. We not only help prepare people who are going to respond, given the fact that they're workers with a set of hazards and risks. We help advise them on the worker safety protocols that they will follow while deployed. Perhaps most famously, to prepare them to go to Africa for the Ebola outbreaks, and there's actually one currently underway. We have NIOSH staff deployed to Ebola areas currently. So it continues to be very important for us to give worker safety and health guidance to those people who are responding to public health. Anything else we want to share about CDC before we start? Okay. We are happy to be part of CDC. We are headquartered in Atlanta, the only federal agency not in the DC area. And we are really happy about that usually. Gives us a little bit of insulation to the hubbub of Washington, DC. NIOSH itself has about 5 or 6 locations, one including just next door in Morgantown. And we're really pleased to be able to share a close relationship between West Virginia University and our Morgantown campus. And one of our senior leaders in Morgantown, Dr. David Weissman, is here. Thank you for coming. And I know you've had a long-standing history here. We're going to talk today, though, about total worker health, and we're going to do it in the context of a couple of key issues. What is life like now in the post-pandemic era as a worker and as an employer? And what are some of the major challenges that we as a nation are facing in this post-pandemic, post-acute pandemic era, if you will? Workers continue to face a variety of threats, both traditional, some that you've thought of, some that your own laboratories are looking at and studying, as well as new ones. And it's oftentimes that mix of old hazards that are not quite taken care of yet, and new ones that are not fully appreciated or characterized yet, that offer the most complex challenges to workers, right? Because there's hangover effects that have been around for 50, 60, 100 years that are still not fully elucidated, as well as new risks on the horizon. And that interplay really calls for what I would say is different than the traditional approach to controlling workplace hazards. The total worker health really is taking that leap into what is it going to take, not only to protect people from all of the hazards, old and new, that they could potentially experience, to move beyond seeing work as something more than just a series of negative exposures. So how can work be designed? How can the actual content of the day in, day out job be changed, be optimized? How can the way we're employed, the way we choose a career, the way we're paid, the way we put together our schedules, how we are engaged with someone who pays us for our services, how can all of those things be optimized to create better health outcomes? And that, I know some of your departments here are specifically looking at the health effects of not having a job, right? That is perhaps one of the most concerning poor health outcome contributors, is that people are not able to work or don't work. And we're starting to uncover why that is. What is it about work that is so influential? One thing for certain, workplace risks and potential, we believe is really not fully recognized. So being able to optimize those conditions extremely important. The elephant in the room for many employers now is their concern over the state of their workers' mental health. If I were to look at all of the incoming questions we get to our total worker health inquiry box, how many are referred to us from CDC's inbox that have a workplace flavor, how many that come into the health hazard effects, and the NIOSH inquiries from employers and workers around the world, a vast majority of those are focused on mental health and its connection to work. Workplace stress is a hot topic right now. Substance use disorders and its connection to work, very, very hot topic. And just mental health in general. I got to speak to the National Employee Assistance Professionals Program not long ago. And one of the things they said, it's really interesting. We always saw anxiety. We always saw folks who had depression symptoms coming in front of us. The two things that we have not seen before, that now in the post-pandemic sort of return to work phase, we're seeing. One, lots of our employees are complaining of loneliness, a disconnect, a detachment from their social supports and peers. It's interesting. Many people tell us their best friend in the world is someone they work with. So this loss of connective social glue that the workplace oftentimes gives folks day in and day out. The other interesting thing that EAP professionals told me, we're seeing lots of folks complain of social anxiety disorder. I'm lonely, but I'm afraid of resuming those personal connections with others. So it's almost like this paradox, this very difficult scenario to imagine providing assistance within. That is certainly reflected in what we're hearing from employers. We're going to pass it over to Chia-Chia.
And in addition to these new things that have come up through the pandemic, there's also the traditional hazards that have always been around, such as working long hours. This is an infographic that was released recently, just last year, by the WHO, the World Health Organization. It's not new information, it's just presented nicely. We already knew this. It shows that people who work more than 55 hours per week are at greater risk for heart disease 17%, stroke by 35%. And the point of this is to say that these things have traditionally we thought of as a separate issue. Heart disease, that has nothing to do with what we do in the workplace safety and health. Maybe that's general public health, but that's not occupational safety and health. But it actually could be. And at NIOSH, we always cite off our numbers, 4,000 people die from workplace-related injuries and illnesses. But when we look at the burden of something like heart disease, lung disease, it's even greater. Millions of people die from that. And the question is, can you really draw that distinct line? Can you really say that heart disease is not related to work? As this infographic shows, you cannot. It is absolutely related. And there's another slide which I don't have, but it actually shows that globally, 750,000 people die from working long hours. That is greater than the number of people who die from things like air exposures, hazardous air pollution exposures at work, or the people who actually die from injury. So these things, which we as occupational safety and health professionals really dedicate a lot of time to, we could be missing out on an even greater hazard. And there's also information that shows that this type of heart disease and working long hours varies across occupations and industries. So it's not just a matter of telling people they need to, improve their cardiovascular health, but we want to look at the workplace and what is the workplace doing. People don't get a choice regarding working 55 more hours a week. Sometimes you do it because you want the extra pay, but even if you are doing that, why can't you get paid more enough so that you don't have to get to the point of working 55 hours or more? And studies have also found that the burden of working long work hours and the health impact of that is there's a dose response, there's a gradation effect. So the longer you do it, if you do it for 1 decade versus 3 decades, the worse the health outcome. And as Casey said, there's more and more attention about this. The Surgeon General the Office of the Surgeon General has been interested in this in a long time. The previous Surgeon General released a paper about the value of worker well-being, and then before he left, he released a paper on the connection between economic prosperity in communities and worker safety and health. And the Surgeon General recently released this report on workplace mental health and well-being. The stats talk for itself. 84% of respondents say workplace conditions impact their work. 81% of workers say they're looking for workplaces that support mental health. Another 71% say that there's at least one thing at work that impacts their well-being. So this isn't something, I'm glad this isn't something that's just for public health professionals, but the general public is becoming more aware of these issues. And then again, going back to the pandemic, what's the relationship between what we've already been facing for worker safety and health, and now how it's gotten worse for the pandemic? For example, these are things that have gotten worse. Intense physical and emotional labor. That's for essential workers, such as healthcare workers, or the frontline workers, the people who've been delivering our groceries during the shutdown, What kind of physical labor are they encountering? All the packages you're getting from Amazon, all the people doing the intense work of that, they're exposed to these, and even worse because there's more of it. A staffing shortage could become even worse during the pandemic. We all have heard about this all the time from employers. Exposure for healthcare workers, exposure to human suffering and death. You know, during the pandemic, you know, you're applauding the healthcare workers, but that has very little impact on the things they have to face during their work hours. And the traditional things they face, hazards, hazardous drugs and violence and disease, and long and regular work hours. Again, that's true for healthcare workers, but think about that for other types of essential workers. The grocery stores, the grocery store, they open 24 hours a day, long hours, irregular hours, or the unpredictability of hours. Back to those app workers, the ones who you call and you get a ride, or you can have your groceries delivered within, you know, an hour or two. They don't know when they're gonna have a job. They don't know when you're gonna need something. What does that do for your mental health if you don't know if you're gonna have to work? You can make plans with your loved one because you'll be going to work. Those are things that have already been around, and then it gets worse. PPE shortages, enough said, more fatigue, grief, and loss. I think almost everybody's known someone who's been affected by COVID. What does that do for your mental health and how you are when you're trying to think about going to work, whether you want to get exposed to something at work, and weighing the benefits of getting paid versus the benefits of taking care of your own health. And of course, increased threats and hostilities and violence. We've got studies that found that public health workers have been exposed to more psychological violence and bullying and harassment at work, and that I think the study found that there's actually an increase in the number of people who think it's okay, who are actually responding, it's okay to harass healthcare workers. So things have gotten worse. They were bad to begin with, but things have gotten worse.
Yeah, some folks tell us they feel like they're just in survival mode, right? They're sort of trying to pull all of these challenges together and just barely get by day in, day out. Certainly, as the pandemic drums on, these things get concentrated. A nagging issue becomes obviously something that more interferes with our quality of life and our ability to cope. High stress levels reported in nurses and doctors. These numbers are 80 to 90% reporting significant stress. More than half of some nurses intending to leave the profession. You know, at some points during the pandemic, these numbers were staggering, overwhelming. We continue all to struggle with inflation, you know, the day in and day out challenges of the supply chain, just our normal exposure sort of this compilation of issues that we're dealing with all at once. We're hearing more and more employers say it's more difficult to attract and retain workers. This whole issue of quiet quitting, which means I'm here at the job, but I'm not necessarily doing any more than necessary. I have a few folks who are like that before the pandemic, though. So I'm not sure that's all.
You're looking at me. What is that?
Oh, no, not personal. We might share folks in common who we know. But clearly this can be a challenge for both workers and employees. And interesting, 1 in every 3 employees say their return to work has had a negative impact on them. Maybe getting to that issue of social anxiety, sort of this just continued series of shifts. I do want to draw attention to some national trends, though, that we're continuing to track closely. And perhaps one most dramatically is life expectancy losses. On the next slide, I'll go into more detail on that. And while the numbers may seem small, I'll tell you why this is such an important metric for us to track, and also why we may not yet have the full picture of what the post-pandemic life expectancy numbers may look like. We've also seen an increase in overdose deaths and suicides in some demographics. And it's interesting to track where these overdose deaths are coming from. There are geographic differences. There are differences among occupation and industry as well. Did you know that if you're a construction worker in the US, you have 7 times the risk for overdose death than if you are in another profession? Now you have to think, certainly it's not just folks prone to substance use disorder who sign up to be construction workers. It's the very nature of the way people are employed, the job conditions, the proneness to injury, the insecurity of the work, the boom or bust of the work, a host of occupational issues that are driving this outcome. And it really begs the question, how can we better design work? How can we better employ and better guarantee wages and income in this group to help address some of these challenges. Many people have argued, gosh, you don't really need to be in the substance use space. That's SAMHSA's lane, that's HHS, other parts of HHS. In the state of Massachusetts in 2015 and 2016, the leading cause of death on the job in the workplace was drug overdose for the entire state for 2 years. The leading cause of workplace death. This implicates work, conditions of work, conditions of employment in the midst of this crisis. The pandemic also has delayed chronic disease screenings, and that is why I say we may not yet fully understand the full life expectancy losses related to the pandemic. We're already seeing increases in later cancer diagnoses, that these numbers are early, but it continues to be concerning. And does it sort of surprise you to know there are 250,000 new orphans in the US? Now, the adverse childhood experience of losing a parent is expected to have lifelong mental health complications. So these are just additional issues that we're dealing with. Let's get to some of those issues around work conditions that put workers at risk for poor physical and mental health outcomes. We're talking about life expectancy. If in this room, white men, roughly 2 to 3 years of life expectancy loss. For women, 1 to 2 years for white men. For Alaska Native American Indian, more than 6 years of life expectancy loss. For Hispanic Americans, roughly 4 years of life expectancy. They may seem like small numbers, but unfortunately they represent all of the gains in life expectancy we've seen in 40 years. So these are dramatic setbacks for the very core of public health itself. So these are continuing to be alarming and may not yet be fully elucidated. This is a slide that shows what we're trying to do to improve the mental health of health workers. They are especially hard hit, and I think it's important to focus first when we're prioritizing where we're going to intervene. Health workers represents what I would say is a meta influence on overall national health. Certainly, we're concerned about their own health and well-being, their families, their communities, their individual sphere of influence. But yet the mental health of health workers, we believe, also has the ability to either add to or take away from the mental health of the nation, from the health and well-being of the nation. So really intervening for them and getting appropriate interventions for them, we think will have a number of positive implications. About 18 months ago, NIOSH received $20 million to launch a national campaign to improve the mental health of health workers. And we've started a number of programs to do that. We're better learning what the lay of the land is. What is the evidence base out there for intervening in healthcare spaces? So we're understanding the health worker burden and also assimilating evidence of what actually works to improve their mental health. We're partnering. We're using the American Hospital Association, the Joint Commission, the National Academies of Science and Medicine, the American Nurses Association, the AMA, the U.S. Surgeon General's office to find the best way to reach populations at high risk. We're identifying those tools that work and what kind of interventions actually will make a difference. And then we're generating awareness through a national multimodal social media marketing campaign that launches in a couple of months. So we'd love to share more on that as it launches. What we're hearing is there's a disconnect between employers and workers when it comes to the stressors that these workers are receiving. Workers are saying, yeah, my employer may have a program for me, but I don't have any time to use it, right? I'm too busy. I'm not getting adequate breaks, adequate rest. My schedule's too difficult for me to take advantage of services that are offered. At the same time, we're hearing from employers, we're doing all this stuff and nobody participates, right? So we're trying to develop ways to bring those two disconnected parties together to better understand the program and to create really changes in the way that work is designed. These were issues before the pandemic and they're only got worse. So more to come on that as the national campaign unfolds.
And I want to say one more thing about the healthcare workers is that it's particularly challenging for healthcare workers because their mission, their purpose, their goal is to help people. So it's very hard for people like that and first responders, firefighters, after the World Trade Center fell. It's their mission. And so it's especially hard to get these people to care for themselves. They're willing to make that sacrifice. And again, it's not just healthcare workers, but even think of the social workers, the teachers, the people who are in social services. They're really committed. It's their mission, it's their purpose in life. And to ask them to say, no, you should step back and take care of yourself. They sort of feel guilty, there's got this moral injury. It's like, well, if I take care of myself, what about the rest of the world? And that makes it particularly challenging and particularly important to take care of them, because that's what NIOSH does. We're the ones looking out for the workers themselves. And it's going to get worse for the future. We talked about past hazards, we talked about pandemic, and what's going to happen. I think it's going to keep on changing. We before the pandemic, we had a future of work initiative. We released a paper, and the pandemic happened. I'm like, oh, we need to update the paper because it keeps changing. And mental health conditions, along with physical health conditions, are going to change too, more faster than ever. The changes are happening. Precarious employment, that is non-standard work arrangements where you don't have a standard full-time job, you're not in the same job for your whole life. It changes. Now, what does that mean when you're going from job to job? And for your personal care provider who's trying to track your working conditions, it's going to keep changing. And also, if you don't know when you're going to have a job, if you're a contract worker, if you don't have job security, what does that do for your mental health? All that, it could particularly could become more common because the employment patterns are changing. We are no longer working the same place for such a long time. Another thing that we're hoping will happen is that there will be more awareness of mental health issues and hopefully reduction in stigma. I don't know about you, but maybe because I'm tracking it every day, there's something about mental health. Some companies got some initiative. I think just yesterday, the Department of Defense announced that they're going to hire 2,000 new workers to help the mental health of their workforce. So it is good that there's more attention to this. And I really like that there's awareness of how you can make upstream changes. During the past couple of years, people become more aware of health inequities, social determinants of health, the systems issues related to, say, racial injustice. And I like that people are understanding the word systems, social determinants, because we would apply that to health, to systems approaches to health. And there's more understanding of that. And there's more awareness about the role that employers can do. You don't have to just wait for regulations. You don't have to wait for compliance and for something to be enforced and mandated. Employers are recognizing that to be a competitive employer, hire people during this time of it's hard to find a worker. You really want to be a model employer, be the best one. And there's more types of services available, all the online counseling that's available. That is good. People are aware of that, and they're, telehealth, those models are changing, and those are also good. And there's more awareness of worker well-being, which again is a benefit. But of course, things keep changing. You can barely keep up, right? Like I said, we wrote this paper, and now there's this whole metaverse thing. And how is that going to impact work? It's going to displace workers. Well, we're using it to do hiring promotions or to make decisions. And what's that going to do for employment law? So we don't have the answers. It's just an example of how just when we've got something, new things come up. NIOSH, we have the future of work, and now we've got the strategic Foresight initiative. It also has webinars. You can go listen to those too. The idea is we started the process. The idea is to really envision in the future. The short term is 5 to 10 years. Midterm is 2 or 3 decades. Long term is far, far in the future. Imagine scenarios of what is life going to be like? What is work going to be like? How do we prepare for that as occupational safety and health professionals? So that is very, very sort of long term. And the key is imagine all the different scenarios and to imagine what we can do about it and to start that now, because by the time we get there, it's too late. And the key with that is to really think about the things that seem unlikely, but we need to prepare for. Who would have imagined? I did not imagine the world was going to shut down during the pandemic, but it did. And what can we do to prepare that for the next time it comes around?
We're also trying to make the argument that mental health attention belongs squarely in the workplace, because there's also folks who say, no, it's not where we want to be spending our time. It really isn't an industrial hygienist role to be looking at how mental health impacts some of these challenges. But we think there's an argument to be made. There are already communication structures in place. People already report to work. They're involved in a common good, a social purpose. they're all working together. There's structures that really make this an ideal environment to address some of these bigger traditional non-work issues. Privacy and confidentiality, especially around workplace injury and some of these sensitive topics, there's already a format and a role for that. EAP programs have a long-standing history in workplaces. We also think employers have a role not only to improve conditions of work and to better design work, but to help people seek and get care. So appropriate benefits, parity between physical and mental health. These are all something that employers have a strong role in, especially if they offer healthcare benefits. And employers usually have systems to track data. What we're strongly proponents of is not endangering people's privacy, the confidentiality, and also finding ways to help them remain at work, because that's squarely an accommodating workplace is essential for people in recovery from a mental health condition or substance use disorder. We also think that there should be more upstream impacts, more upstream approaches for mental health in the workplace. And what does that mean? You know, there is not enough that can be said about offering more flexibility in the work experience. Flexibility is oftentimes the antidote to so many other challenges that workers face. The other key investment that I think employers need to do more effectively is to better train frontline managers and supervisors. I've long made the argument that a frontline manager is more important to your personal health and well-being than your private physician will ever be. They just have so much control over so many aspects of your life. They play an important role, oftentimes undertrained, underskilled. They don't have the listening people skills. So investing more in this concept of supportive supervision is extremely valuable for a workforce under distress. This whole seamless connectivity to care, if someone says, hey, I'm having a challenge, have a ready plan to help train frontline supervisors to recognize people who are struggling before there's a crisis. And there are ways that this skill set can be developed. And then again, we just want to emphasize privacy and confidentiality. Our antidote to many of these challenges is this total worker health approach, and it's really why we're here. For us, total worker health is really about this combination of keeping workers safe. If you don't keep workers safe, right, they go home with less health than they arrived that morning. That is the traditional role of occupational safety. At least send folks home with the same health they arrived with at the end of the day. That's what a good company does. But we're here to say that the best companies do more than that. They keep workers safe, but then they invest in the health, safety, well-being of their workers by better policies, better programs, better supervisory and regular day-to-day practices. And in turn, those workers go home with more health than when they arrived that morning. Now, that's obviously good for the family, the community, the worker himself, herself. But those workers who went home today with more health, the next morning they come back to the workplace with more health as well. And then the organization can benefit. Fewer injuries and illness, better customer service, less conflict in the workplace, less healthcare spending over the long term, less risk for the company as a whole. And this really, we believe, is the win-win-win. The employer, the worker, the community, and society all benefit from this total worker health approach.
Yeah, I want to add on 3 points. One is basically that it's all about the worker. It's human-centered. You know, people say something that's system-centered. It's about human-centered. It's about designing the job to fit the worker. The example, you know, I was talking about like healthcare workers and social workers. A lot of times people say, well, you know, you need meaningful jobs. You want people to be engaged. Well, the key is, you know, how engaged do they want to be? Because if they have a whole life outside of work, they don't, you know, the more engaged you are, the more potential you have to be feeling like you need to make that sacrifice. You need to do more. So the key is, what does the worker need? So really ask the worker where they are in their life. How important is this to you compared to whatever else is going on? You may want meaning in your job, but you don't need to be burning yourself out for it. Another thing is for total health approach is for it to be really systems and upstream. So it's not about changing behavior one person at a time. That takes. It's about systems approach. We can change the policy for the entire workplace. With a snap of one finger, you have a whatever smoke-free campus. That's it, done. Versus trying to have patches on individual people. And the third thing is the overall vision is for work to be a recognized means of achieving well-being. We already know that work is good for you, if you sort of retire and quit your job and you don't have a reason to get up in the morning, that's very bad for your health. Decades of research have shown that. So it's knowing that work could be helpful to your well-being and really building on that. So it's not just keeping from people being harmed, but making it better. Now, of course, we've talked about worker well-being. That is welcome for worker well-being. That what exactly is worker well-being? A few years ago, we realized, oh yeah, there's no actual definition for that. So we worked to develop a framework and a definition for that. There's a long definition, which I will not share with you, but the point is that we say it has a subjective and objective component to it. It's not just a matter of telling people to become more resilient and think positively, because there's research that shows there are objective things such as socioeconomic status that makes a difference in your health and well-being. And that it's multidimensional. So we created this model for worker well-being. It's got 5 domains. We're going to go through it. I'll go through it right now just to show you the 4 domains, but also the perimeter, the home, community, and society. It shows that it's not just, you don't just work in a vacuum, you have a life outside of work, and that worker well-being impacts the community and society. If you don't, if you quit your job now, eventually you could potentially be back in the workforce and you're going to be a part of the community and society, and that influences your well-being too. The first domain of worker well-being is the workplace physical environment and safety climate. So that's the traditional things we think about, but it does include psychosocial health. Have you had bullying or harassment? You feel discriminated at work? That's a part of this domain. And if you are able to telework, it would include that too. What's your teleworking situation like? Do you have isolation? Do you have social connection? That's Casey said. That's important. And of course, it's a work environment that's safe. The second domain is workplace policies and culture. That includes things such as, do you have access to paid sick leave? During the pandemic, you had to choose between getting a paycheck or your own health. And it was not a pretty decision for many people. Policies and culture, do you have the benefits to get the care you need for like a return to work? Casey and Dr. Howard talked about return to work. The benefits you have that would cover that. Do they support you working part-time? And also, do you have benefits for reskilling and upskilling? We're talking about the future of work and technology and people being displaced and replaced by technology. Is there training at work to provide for that? So there's a lot of potential for this very upstream approach to impact workers. The third domain of worker well-being is worker evaluation experience. I say that's sort of like the subjective aspect of it. Studies have shown, one study by our Oregon Center of Excellence for Total Work Health, they have a supervisor training, and they found that supervisors who've gone through the training, which talk about the importance of worker well-being and how they can support the well-being of their workers. The workers reported better sleep, greater job satisfaction, better physical health. And studies have shown that if you feel like you're able to use your skills at work, it's better for your worker health. And if you feel like you're concerned about your job security, you're going to be less engaged. But if you have a supportive supervisor, that actually helps. So these are the type of things that are really based on how does the worker feel. You can do surveys and ask people, what is your perception of your work environment and your supervisor? What's that culture like? The background pictures is a Zoom call with the Total Work Health team, but the point is to say that, even if you are able to telework, how are you feeling connected with your coworkers? Do you have that sense of camaraderie? Because that's going to impact your well-being and how supported you feel. The fourth domain is called status. That is all the typical things you would think about related to health. We, for our model, we separate it into 5 domains, but we know it's not that simple. There's a lot of overlap, right? So for insomnia, feeling sleepy at work, that is sort of an individual health thing, but that is, remember those policies we talked about, working 55 more hours a week, it has an organizational component too. What's the policies like? Are there enough workers that allow you to take off when you need to, or are you short-staffed, so therefore you need to work extra hours, so therefore you got insomnia and you're feeling sleepy at work. So even though this is the individual health status, the key is to still link it upstream to what can the workplace do to influence that. And things like injury, in the first domain of the physical environment, that talks about the physical environment and injury. But then the impact could be on the actual impairment at work. Are you able to get done what you need to get done? How does it impact your activities and daily living? So again, these things that seem to be individually health focused could potentially be rooted. Root cause analysis we do it could be actually point back to the workplace conditions. And the last domain is home, community, and society. As odd as it sounds, our studies have found that there is a direct linkage between family members and worker injury. It's fascinating. It goes both ways. I think it was like workers who have been injured at work within 3 or 6 months of that, it's more likely that they would have a family member who has a hospitalization. You think about that. Someone's injured at work, very soon afterward, someone in the family has a hospitalization. And it goes to conversely too. I think it's someone who had a family member who's been hospitalized is also more likely to be injured at work. So again, all these things that we think, oh, well, that's not part of worker safety and health. It actually could be. And the point is to say it increases the burden. So when we're trying to make a case for why people should care, why employers should care, why this important research should be done, all these numbers, if you include that as being work-based, it really increases the impact and the potential outcome of all that we do. And life satisfaction, how satisfied are you at work? That's related to injury. Do you feel like you can meet your bills? Do you feel like you can make ends meet? How is that related to work? It is. It's based on how much you can get paid. And do you feel like you have the social and emotional support you need? Do you feel like you can get involved in community activities? All that is related to work, because if you are working too many hours, if you're working shift work, you can't do many of those activities. Based on this, the worker well-being framework, we actually created the worker well-being questionnaire, the Wellbeing Key. It is free for public use. So for researchers or people who are in organizations, you could download the survey from our webpage, administer it. We think it can be completed about 15 minutes, and it's also available in Spanish. And soon there will be a clearinghouse to collect the data, so that anonymous data, and it will be free for public use. So we're hoping that as people use the survey, they'll share the survey in the clearinghouse, and then research within organizations can get their benchmarking data from that. A couple of final things about that. We do recommend that the Wellbeing Key instrument be used in its entirety, because the purpose was to capture all of worker well-being. If you're interested in only specific sections, there's a whole citation table. We can go to those sources. And we do recommend that if you are using it outside of the context of Wellbeing Key, you make sure you have the permission and comments from the source authors. And the last thing is, of course, the purpose of the reason for doing all this is so that we could see how workers are doing. We talk a lot about worker well-being. There's a way to actually measure it. And importantly, to identify intervention. So all those different domains, you could see how workforce is doing, how it's doing in the different domains, and then target intervention to do that. So it's a way to identify policies and programs that could be improved, and then improve it. And then of course you administer the survey again. So the key is to take actions, not just assess worker well-being, but to actually use the questionnaire to then see opportunities for improvement. Because we don't ever want to administer a survey and not do anything about it. That would not be a good use of anybody's time, and workers are less likely to want to be involved in the future.
We can't say enough really about the role of supportive environments, including managers with the right skill set and training to act on findings that might arise from something like the Wellbeing Key. These are really essential ways to move the total worker approach. We sort of say there's really just a handful of things that companies that really want to embrace this really should start doing. Get more involvement from workers. We call it that participatory approach. Basically means ask workers what they need, what their challenges are. The Wellbeing Key is a great way to do that anonymously. And then use that employee input to really design the facets, the programs, the approaches to the total worker approach. The other is better supportive supervision. What does it take in the climate, in the environment, to improve those opportunities for help to actually arise? If we look more broadly at the NIOSH portfolio in this space, we really have 4 major areas of significant work that really all fit nicely with total worker health and help us move the work forward. We've described our total worker health approach. For those industrial hygienists in the room, we developed a hierarchy of controls using the traditional total worker health model onto the traditional hierarchy that's so common in industrial hygiene. We also have the healthy work design cross-sector. that's really open to outside input. So if any of you have a strong interest in this space, we have a national council where we invite folks with an interest to join us in the exploration of this work. I described earlier our Mental Health for Health Workers project. And then lastly, we have a 30-40-year history of looking at workplace stress, its prevention and its antidotes, its interventions. And those really are sort of the core components of the NIOSH program related to total health. We fund 10 centers of excellence to do research in this space, including the ones that you see here. 6 have been around now for more than a decade, and we just added 4 new ones, including the one at Johns Hopkins on the next slide, which is a total worker health center specifically dedicated to workplace and mental health research. This is one of our newest centers. They're focused especially on frontline workers, essential workers, health workers. So we're really interested in the outputs of this group given the current state of affairs. We also really want to just sort of say that we're really focused on what the workplace of the future will look like. This is my granddaughter, Lily, and she reminds me oftentimes that she wants to be one of the Disney princesses when she grows up. I'm not sure there's much longevity in royalty. No, is there? Okay, we'll see. But I'm concerned about what the future of work will look like for her, as I know you guys are for your kids and friends, family, your grandkids. So for me, this is really, the final days of my career is really going to be dedicated to thinking about how we can improve work for the long haul. To me, that's really my goal here with the Total Worker Health Program.
We want to give you time to ask questions. Just 1 or 2 more slides wrapping up. One is, we've talked a lot about all the bad things that's happened. We wanted to leave on a slightly more positive note, which is one thing that's come out of the pandemic is that there's been more awareness of mental health issues. We think that is very good, a good opportunity. And I would say relates to that more awareness in general of worker health issues. Now people go to restaurants and they're sort of thinking about that person who's bringing them their food and they're giving them, oh, maybe I should, they're thinking about that a little more, and I think that's good. The opportunities for improving health because of remote work and hybrid work, the flexibility. There's potential for that. That's really good. And again, employers are really, particularly right now, increasing investment and dedication to worker well-being. So we think there's opportunity to really seize this moment and move it forward. We're just ending with resources. There's the supervisor training I talked about at the Oregon Center of Public Health. It's at this Oregon Center of Excellence for Total Work Health. It's free. Our website has promising practices about what organizations are doing. And there's other resources. One of the affiliates has this Total Work Health Employer Guide, also free and available. So there's lots of resources. We have an affiliate network. And I'm pretty sure the answer to that question is yes. I think we're going to get that done any moment. The affiliate network, our organizations, nonprofit, and government organizations are interested in total worker health. That is it. We're happy to take any questions. Definitely keep in touch with us. And we're always, we're just across the parking lot apparently. So reach out whenever you need to.
Yes, thanks very much, guys.
Take any questions. I think this mic would be given to,
Sure.
to the people, and there's another mic here.
Thank you both for a wonderful presentation and for coming here in person. Wonderful to see you in person. Chris Martin, I'm in the Division of Occupational Medicine. And it seems to me that your work is so transcendent that if Dr. Howard wants the next trademark, it should be meta occupational. I can give royalties. This is really a comment, but it raises a difficult question that you can regard as rhetorical if you just want to nod and say, yeah, that's a big problem. I spend a lot of my time as a clinician being asked the question, is this health condition work-related or isn't it? That has huge implications. It has implications for the payer, whether this is going to be handled under workers' compensation, which uniquely in the United States is mostly private. So it's a very harsh, difficult world where they're not really interested in the long-term well-being of the worker. Totally different pots of money versus this is not work-related and therefore it gets covered under the health insurance. Right. And it's in a very adversarial environment with huge implications of who pays for what. And in the most heartbreaking episodes that I hate, it's clearly not a work-related disease. you suspect that the worker does not have any health insurance at all, and people with the absolute best of intentions are trying to get something covered through work. You've made a compelling case that this is a completely false dichotomy. But that's the reality of the world that we work in, and it poses a major problem to furthering the total worker health efforts.
Right.
How do we break down that false dichotomy? How do we incentivize the system to do what everybody should agree is the right thing? That can be rhetorical.
I do think it represents a significant challenge. I just gave a keynote at National Workers' Comp 2022 in Las Vegas, 3,000 people, and they asked me to futurecast the exact answer to that question. Quite difficult to do. I couldn't really say, though, since I had 45 minutes, I couldn't say, just, okay, that's a tough problem. So what I did say, though, was I expect that there will be far more compensability in the future from a mental health and a psychosocial stress standpoint than we've ever seen before. Because I think the evidence is mounting, and there's almost this overwhelming move, especially as we see other developed countries begin to regulate psychosocial exposures and health outcomes and develop national standards and enforcement vehicles to look at that issue. So I think that's an area where we may see far more work-related implication and compensation arise in that space. The chronic disease component, the 1 in 4 cases the WHO says of heart disease that are work-related, the long hours of work that clearly contribute to diabetes, obesity, cancer, other risks like that. I think those are going to be a harder push to see that direct sort of connection between work and compensability. But I expect it to only move toward more compensation and not further away. And in many ways, this argues for a national health system that doesn't artificially divide these two issues. People aren't workers and non-workers, they're one person with shared exposures both directions across that continuum. And it's a false dichotomy. And it's worsened by the fact that we have 50 plus workers' compensation systems in the country and not only one. So.
And this is messy. A few years ago in a country, I don't remember, maybe France, they had, I think there was one company that was doing layoffs and many people committing suicide. And they actually ended up, after years of lawsuits, held those senior company executives accountable. I can't remember if they were fines or they were put in jail, but they were held accountable for the very negative, devastating impact of the horrible culture. It wasn't just the layoffs, it was that people were, told that in a horrible way. The culture was just toxic, and they ended up actually being fined and maybe put in jail.
We're the only developed country without a psychosocial standard enforceable by some entity like OSHA. Almost all of the other countries have an enforceable OSHA type standard for psychosocial exposures at work.
And another not quite regulatory approach is to just even understand that for an occupational safety and health team, not just the occupational provider, not just the IH, not just the safety professionals, but to have occupational health psychologists on the team. A lot of people, most people probably don't know what that is, but there are countries where they actually specify occupational safety health psychologists as part of the team. So even small things like that, which aren't regulatory, could really make a difference.
Hi, I'm Dave Hurst. What do you think about the term quiet quitting? To me, that which means somebody is not doing anything more than they need to. And we're looking at it as a negative. Why do we expect people to do more than they're supposed to do by their job description? Why is that quiet?
She's the champ right here.
And I'm part of that. Nothing to do with that.
So yeah, it's backwards, the whole expectation that people should be doing a whole bunch more than they're supposed to do.
By definition, that's
Yeah, by definition, if you just do what you're supposed to, that's back.
Right. I think Chia-Chia couldn't agree more. She was just saying earlier how this expectation that people let work subsume every aspect of their being